For a KUB radiograph, place the patient in the supine position. Center the IR 2 inches above the iliac crest. For the upright position, center the IR 2 inches above the level of the iliac crest or high enough to include the diaphragm. It may be necessary to orientate your cassette landscape for some patients. For both radiographs, suspend respiration at the end of expiration in order to make sure that the abdominal organs are not compressed. When evaluating the supine abdomen, the area from the pubic symphysis to the upper abdomen must be visualized. This is seen in the radiograph on your left. Also notice that the soft tissue gray tones in the psoas muscles, the lower border of the liver, and the kidneys is well visualized. Looking at the radiograph on your right, it is sure to make the diaphragm visualized without motion. This particular image on the right is of poor quality, and I believe this is due to a large patient size. If the patient is too weak or ill to stand, you may place him or her in a lateral recumbent position lying on a radiolucent pad or a sponge. Use the left lateral decubitus position for most of these situations. If possible, have the patient lie on the side for several minutes before the exposure. This will allow the air to rise to its highest level within the abdomen. Be sure to place the patient's arms above the level of the diaphragm so that they are not projected over any abdominal contents. You also will want to flex the patient's knees slightly to provide stabilization. Using a horizontal beam, direct the central ray perpendicular 2 inches above the iliac crest. Once again, be sure to get suspended respiration after expiration. When evaluating your image, you should be able to visualize the abdominal wall, flank structures, and the diaphragm. Hopefully, you can also visualize both sides of the abdomen. If this is not possible, be sure to elevate and show the side down when fluid is suspected. Also, if air or free air is suspected, be sure to show the side that is up. Proper identification, including the patient's side and marking it with a proper marker of which side is up, is always required. Here is some additional information that is sometimes helpful regarding abdominal radiographs. However, it is very seldom used in common practice. A compensating filter should be used for patients with large abdomens. A compensating filter improves image quality by preventing overexposure of the upper side of the abdominal area. Additionally, a PA projection, upright or supine, can be used when the kidneys are not of primary interest. The upright PA projection should be considered compared with the AP projection because the PA projection of the abdomen greatly reduces patient gonadal dose.